What if you could regain control over your bladder and bowel function? Not with another pill, but by essentially resetting the communication lines inside your own body. Today, we're going to dive into a really fascinating therapy that does exactly that. We'll explore how it works and who it might be able to help. So, to really get why this matters, let's just start with this number 34 million. That's how many people just in the United States are expected to be dealing with the symptoms of overactive bladder, or OAB. It is a massive and honestly an often hidden public health issue. So, what is overactive bladder exactly? Well, the official definition talks about urinary urgency. That's that sudden, really strong need to go to the bathroom that's super hard to put off. And this can happen with or without leakage, and it's often paired with having to go way too often during the day, and yep, waking up at night to go too. But really, at its core, OAB isn't just a bladder problem, it's a communication problem. The signals between your brain, your spinal cord, and your bladder are basically misfiring. It's like the lines are crossed, creating this constant false state of emergency. And as you can imagine, that breakdown can have a huge impact on a person's life. And the sheer scale of that impact, it's staggering. Just look at this number. The projected national cost of managing OEB was $76 billion, and that was back in 2015. That number covers everything: doctor visits, medications, pads, you name it. It just shows you how widespread this issue really is. So, what happens when the standard treatments, things like behavioral changes and medications, just aren't cutting it? For a lot of people with what doctors call refractory OAB, that's the point where it's time to start thinking about a totally different approach. Think of the treatment path kind of like a ladder. You start on that first rung with behavioral modifications, things like managing fluids or doing pelvic floor exercises. If that's not enough, you climb up to the second rung, which is medications. But for those who are still struggling, there's a third line of therapies, and that is exactly where sacral neuromodulation comes into the picture. Okay, so what is this therapy? Honestly, one of the best ways to understand sacral neuromodulation, or SNM for short, is with a pretty simple analogy. Just think of it like a pacemaker, but for your bladder. And this idea of resetting is absolutely crucial. See, SNM doesn't just block signals or force a muscle to do something. It gently modulates the nerve activity. It's more like it's helping restore the normal, healthy conversation between the brain and the sacral nerves that are in charge of your bladder and bowel. And believe me, this technology has come a really long way. Just look at the difference. On the bottom, that's the original device, the InterStim I, and on top is the modern InterStim II. It is so much smaller, which, as you can guess, makes a huge difference for patient comfort. Now, this is the other key piece of the system. It's called the lead. It's this thin, flexible wire with tiny electrodes at the end. This is the part that gets carefully placed right near the sacral nerves to deliver those gentle little pulses that help get the signals back to normal. One of the most incredible things about S&M is how you actually get started with it. It's not this immediate, all-in commitment to a permanent implant. Instead, it's a two-stage journey, and it's completely designed to make sure the therapy is actually right for you. And here's the biggest benefit. The real game changer. You get to test it first. It's basically a try-before-you-buy approach, which is pretty unique for advanced therapies like this. It lets you actually experience the potential benefits in your real everyday life before you decide to go forward with a permanent device. So in stage 1, the test phase, a doctor places that thin lead, but it gets connected to a small stimulator that you wear on the outside of your body. Then, for the next several days, you just go about your daily life and keep a detailed diary tracking your symptoms to see if they're actually getting better. And here you can see what that looks like. The lead is positioned to perfectly follow the path of that sacral nerve. And those little anchors you see, the tines, there would hold it gently in place. That was a major innovation that made this whole therapy much more reliable. So, how do you know if the test was a success? Well, the benchmark is really clear. You're looking for at least a 50% improvement in your main symptoms, based on what you tracked in that diary. If you hit that mark, then you're a great candidate to move on to stage 2. And for those with a successful trial, the process moves on to the permanent implant. This second procedure is usually shorter. The temporary external wire comes out, and the small, permanent device, it's about the size of a stopwatch, is implanted discreetly under the skin, usually in the upper buttock area. All right, so it sounds really promising, right? But what do the numbers say? How well does it actually work? And just as important, what are the potential downsides? Let's take a look at the data. In one really significant study, the results were pretty striking. As you can see here, about 77% of the patients who got the permanent implant hit that clinical success goal of 50% or greater symptom improvement after 6 months. That's a powerful number, and it speaks volumes about how effective this can be for the right person. But of course, no procedure is completely without risk. The big benefits are obvious: major long-term relief from symptoms, and that incredibly important trial phase. On the flip side, the main risks include things like pain where the device is implanted, a potential for infection, and the possibility that the device might need to be reprogrammed or even surgically revised down the road. But it's really important to point out that the technology has gotten so much better at dealing with some of these risks. The invention of that tined lead we saw earlier, that dramatically cut down on the number of revisions needed because the lead moved out of place, which used to be a much bigger problem with the older tech. So, after looking at the problem, the solution, and the results, we come to the final big question. Who is a good candidate for this therapy, and who isn't? Now, this therapy isn't for absolutely everyone. In general, it's not recommended for patients who need regular spinal MRIs, anyone who is pregnant, or someone who might not be able to operate the little patient controller. Also, if there's been major surgery or trauma to that sacral area before, it can sometimes make it impossible to place the lead correctly. And that really brings us to our final thought here. For people who've tried other treatments that just haven't worked, sacral neuromodulation asks a really powerful question. Could resetting your body's own faulty signals be the key to finally getting your life back under your control? It's a pretty amazing idea, right at the crossroads of medicine and technology.